Thank you very much, Lascion Corla and Deputy Daly, and hopefully you'll stay, because otherwise I'll be speaking to an empty chamber, and I will. Sorry. I know you are. I was just saying
Listen
that.
and learn.
And we also have the Minister Jim O'Callaghan coming in, so there's someone in the chamber to hear me. Thank you very much. It was great to finish on words of wisdom and lived experience from Deputy Daly. You're always there to give us all advice in relation to healthcare, and it's just great to hear somebody speaking to the bill. This is possibly, I'm 6 years in the Department of Health, it's possibly my 5th or 6th time speaking on this particular bill, and I look forward to a stage when we won't have to speak on it, that we'll get that piece of legislation, which means that we won't have to come in every year and speak to it. But it is an important piece of legislation. As we know, it's a technical bill with 8 sections focused on the specific area of health insurance. But just a couple of points I do think is worthwhile mentioning. So we know for a fact that a large proportion of people in Ireland have private health insurance, but I do think it's important to put on the record of the House that we have 1.57 million people in Ireland who have a medical card, and we also have over 700,000 people who have a doctor's only card. But I was struck to the point that was made by some of the deputies. There's a cohort of people who can't afford private health insurance. They don't qualify for the medical cards, but a lot of people qualify for doctor's only cards and they haven't applied for them, and I think that's a really important piece that we have to say. I also do want to say, as somebody who has been in the Department of Health for 6 years now, and after completing 6 budgets, it's important to note that what has been achieved, for example, in to reduce the cost of healthcare for families over the last years. For example, free contraception up to age 35. For example, that no inpatient bed charges anymore in our hospitals. You used to be charged up to 10 days a year, and people found that quite hard. And also the reduction in the drugs payment scheme for families, which is capped at €80 a month. So I do think all that has to be factored in as well. Just to put it on, it's important to put things on the record of the Dáil. I also want to thank all those who work in our health services all over the country, whether they're public, private or voluntary. They do a huge amount of work, and every person who goes to work in healthcare every day, I fervently believe they go to do the best job they possibly can. But I do agree with you, our last speaker, in relation to the challenges we have in relation to productivity, and in some instances in relation to culture. And that's areas that we have to see change. Just in relation to the bill, and I suppose I find this every year, that people don't always understand what we're trying to achieve, and it's the risk equalisation scheme. And to explain it in simple language, in a community rated market, that means that everyone pays the same price for the same policy, regardless of age or health, and that's really, really important. But older and sicker people cost more to insure, and without the support of the risk equalisation scheme, insurers with more high-risk customers would face higher costs and premiums could rise. So this is why we have the risk equalisation scheme helps to resolve this. And another point, just to conclude, and I'm always the person who is the glass is half full, I'm very proud of the fact that we have one of the highest life expectancies in Europe. I'm very, very proud of that. I'm also very proud of the fact the work that has been done over previous years in relation to home care, daycare, Meals on Wheels, that triangle of supports that keeps people at home for as long as possible. And if you were to compare the amount of people who are under fair deal in a nursing home in 2019, you will see that it's almost equal to the amount of people who are in a nursing home in 2025, because people are living longer at home with the correct wraparound supports. I'm not saying everything is perfect, far from it, but we have done a huge amount of work to support older people remain in their community, and you only have to look at the amount of home care hours that will be delivered this year. And yes, there are challenges in rural areas, there are challenges at the weekend, but the fact that we have an ageing population who are living so much longer, I think is something that should be cherished, and is something that we should all acknowledge. That's because a lot of really good people are delivering really good services every day of the week. So thank you very much, Ceann Comhairle, and I'll leave it there. I believe we'll have the bill for report in final stage tomorrow evening. Thank you.